Hi all, today I'm here with some of the CBT sample questions, and in fact these sample questions are from the respiratory system. By listening and watching to this video, you can revise the respiratory system related CBT questions, and in fact if you are not interested to read the questions, you can listen and watch these type of videos. So the first question is position to make breathing effective. The options are left lateral, supine, right lateral and high side lying. The correct answer is, as you can see, high side lying. The position to make effective breathing is high side lying. Next question, in normal breathing, what is the main muscles involved in inspiration? The options are the diaphragm, the lungs, the intercostal and all of the above. Correct answer is the diaphragm. Diaphragm is the main muscle involved in inspiration. Question number 3. You are caring for a 17-year-old woman who has been admitted with acute exacerbation of asthma. Her peak flow readings are deteriorating and she is becoming wheezy. What would you do? Option A. Sit her upright, listen to her chest and refer to the chest physiotherapist. Option B. Suggest that the patient takes her Ventolin inhaler and continue to monitor the patient. Option C. Undertake full set of observations to include oxygen saturations and respiratory rate, administer humidified oxygen, bronchodilators, corticosteroids, and antimicrobial therapy as prescribed. Option D. Reassure the patient. You know from the readings her notes that stress and anxiety often trigger her asthma. The correct option is, as you can see, option C. Undertake a full set of observations. Next question, your patient has bronchitis and has difficulty in clearing his chest. What position would help to maximize the drainage of secretions? Option A, lying flat on his back while using a nebulizer. Option B, sitting up leaning on pillows and inhaling humidified oxygen. Option C, lying on his side with the area to be drained uppermost after the patient has had humidified air. Option D, standing up in fresh air, taking deep breath. As you can see, the correct answer is lying on his side with the area to be drained uppermost after the patient has had humidified air. Question, why is it essential to humidify oxygen used during respiratory therapy? Option A, oxygen is a very hot gas, so if humidification is used, the oxygen will burn the respiratory tract and cause considerable pain for the patient when they breathe. Option B, oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection. Option C, humidification cleans the oxygen as it is administered to ensure it is free from any aerobic pathogens before it is inhaled by the patient. Option D, humidifying oxygen adds hydrogen to it, which makes it easier for oxygen to be absorbed to the blood in the lungs. This means the cells that need it for intracellular function have their needs met in a more timely manner. The correct answer is option B. Oxygen is a dry gas which can cause evaporation of water from the respiratory tract and lead to thickened mucus in the airways, reduction of the movement of cilia, and increased susceptibility to respiratory infection. Next question. Prior to sending a patient home on oxygen, healthcare providers must ensure the patient and family understand the dangers of smoking in an oxygen-rich environment. Why is this essential? Option A. It is especially dangerous to the patient's health to smoke while using oxygen. Option B. Oxygen is highly inflammable and there is a risk of fire. Option C. Oxygen and cigarette smoke can combine to provide a poisonous mixture. Option D. Oxygen can lead to an increased consumption of cigarettes. The correct answer is option B. Oxygen is highly flammable and there is a risk of fire. Next question, which is not considered in an oxygen prescription? Option A, it should be prescribed. Option B, regular pulse oximetry monitoring must be available in all clinical environments. Option C, can be given to patients who are not hypoxemic. Option D, it must be signed and dated. The correct answer is option C, can be given to patients who are not hypoxemic. Next question, Mr. Green, a COPD patient was sent home with oxygen prescription at 2 liters per minute. He is dyspneic, anxious, panicking when you visited him. What is your most immediate nursing action to relieve dyspnea? Option A, call the emergency department for ambulance. Option B, increase oxygen rate. Option C, tell patient to calm down in a loud voice. Option D, calmly instruct patient to do deep breathing. The correct answer in these options are option D, calmly instruct patient to do deep breathing. Next question, which of the following oxygen mask is available to deliver between 60 to 90% of oxygen when delivered at a flow rate of 10 to 15 liters per minute? Option A, simple semi-rigid plastic mask. Option B, nasal cannulas. Option C, Venturi high flow mask. Option D, non-rebreathing mask. The correct answer is, as you can see, option D, non-rebreathing mask. Next question, patient is in for oxygen therapy. Answers, a prescription is required including route, method and how long. Option B, no prescription is required unless he will use it at home. Option C, prescription not required for oxygen therapy. Patient is in for oxygen therapy. The correct answer is, a prescription is required including route, method and how long. The next question, what percentage of the air we breathe is made up of oxygen? Option A, 16, option B, 21, option C, 26 and option D, 31. The correct answer is option B, 21. Next question, you are caring for a patient with a history of COAD who is requiring 70% humidified oxygen via a face mask. You are monitoring his response to therapy by observing his color, degree of respiratory distress, and respiratory rate. The patient's oxygen saturations have been between 95% and 98%. In addition, the doctor has been taking arterial blood gases. What is the reason for this? Option A, oximeters may be unreliable under certain circumstances. Example, if the tissue perfusion is poor, if the environment is cold and if the patient's nails are covered with nail polish. Option B, arterial blood gases should be sampled if the patient is receiving above 60% oxygen. Option C, pulse oximeters provide excellent evidence of oxygenation, but they do not measure the adequacy of ventilation. Option D, arterial blood gases measure both oxygen and carbon dioxide levels and therefore give an indication of both ventilation and oxygenation. The correct answer is option D, arterial blood gases measure both oxygen and carbon dioxide levels and therefore given an indication of both oxygenation and ventilation. Next question, what should be included in your initial assessment of your patient's respiratory status? Option A, review the patient's notes and charts to obtain the patient's history. Review the results of routine investigations. Observe the patient's breathing for ease and comfort, rate and pattern. Option D, perform a systematic examination and ask the relatives for the patient's history. The correct answer is option C, observe the patient's breathing for ease and comfort, rate and pattern. Next question, what is the most accurate method of calculating a respiratory rate? Option A, counting the number of respiratory cycles in 15 seconds and multiplying by 4. Option B, counting the number of respiratory cycles in 1 minute. One cycle is equal to the complete rise and fall of the patient's chest. Option C, not telling the patient as this may make them conscious of their breathing pattern and influence the accuracy of the rate. Option D, placing your hand on the patient's chest and counting the number of respiratory cycles in 30 seconds and multiplying by 2. The correct answer is option B, counting the number of respiratory cycles in 1 minute. One cycle is equal to the complete rise and fall of the patient's chest. Next question, when using nasal cannula, the maximum oxygen flow rate that should be used is 6 liters per minute. Why? Option A, nasal cannula are only capable of delivering an inspired oxygen concentration between 24 and 40%. Option B, for any given flow rate, the inspired oxygen concentration will vary between breaths as it depends upon the rate and depth of the patient's breath and the inspired flow rate. Option C, high rates can cause nasal mucosal drying and may lead to epistaxis. Option D, if oxygen is administered at greater than 40%, it should be humidified. You cannot humidify oxygen via nasal cannula. The correct answer is option C. Higher rates can cause nasal mucosal drying and may lead to epistaxis. The last question is, what is respiration? Option A, the movement of air into and out of the lungs to continually refresh the gases there, commonly called breathing. Option B, movement of oxygen from the lungs into the blood and carbon dioxide from the lungs into the blood, commonly called gaseous exchange. Option C, movement of oxygen from blood to the cells and of carbon dioxide from the cells to the blood. And option D, the transport of oxygen from the outside air to the cells within the tissues and transport of carbon dioxide in the opposite direction. That is the correct answer. The transport of oxygen from outside air to the cells within the tissues and transport of carbon dioxide in the opposite direction. These are some of the most commonly asked questions from the respiratory system in the CBT examination. Hope you guys enjoyed this video and found it beneficial. Don't forget to subscribe to my channel if you found it useful, and share it with your friends as well who are preparing for CBT examination. All the very best for your CBT examination, and give me a thumbs up if you like this video. Bye bye and see you soon with another video.